Hello everybody, I'm Greg Stock. I'm the CEO of Thibodaux Regional Health System. I'm here today with Dr. David Patten, pulmonary physician, expert in respiratory matters, and Dr. Paul Monier, who is an infectious disease physician and an expert in infectious diseases. And we'd like to discuss with you what's happening at Thibodaux Regional with regard to COVID and some advice and comments regarding the importance of vaccines. First of all, as I think you know and many of you have experienced, the hospital is very busy, busier than it was at the onset of COVID last year. We have 50 plus patients in the hospital right now. That number has varied some, but generally it has continued to drift upward. And over the last several weeks, we basically have completely filled our hospital to capacity, especially with regards to staffing. Staffing is the challenge all these hospitals face, including ours. At the same time, we're trying to serve the community at the best, at the highest level that we can, and it's very challenging. But at this point in time, I think I'll ask Dr. Monier if he would just comment a little bit on this mutant strain, some of his thoughts and what he's seeing, and then Dr. Pat.
Sure. So we're seeing this Delta variant now, and as Greg said, we're seeing, the most striking thing is the age of the patient. We're seeing patients who are now sometimes in their 20s that are on ventilators. We're seeing on average the average age of the patient coming down. So maybe that's the most striking thing we're seeing with this variant that has really made all of us take notice. But it's just boils down to it's making patients sicker and making more of them sicker. And we're seeing that in the community. We're seeing increasing numbers, and with increasing numbers, you're going to see increasing hospitalizations. And from what I've seen, that curve is still headed straight up. And as long as it's doing that, we can expect to see more patients come in. And we're going to have to be ready for this challenge. It doesn't look like it's going to let up anytime soon. But again, it's a highly contagious virus. It spreads more easily than the previous version of COVID. And again, making more people sick. And it seems to me, at least from where I sit, making people much more ill than what we dealt with in the past.
Yeah, I just reiterate what Dr. Monier said. It feels different. It feels completely different to me. We're seeing the same radiographic pattern. We're seeing a lot of the same patterns of people getting sick, but people are getting much sicker, and they get sick rapidly. So they can come in and just be on a little bit of oxygen, looking fine and talking to me, and then by that evening, they can be crashing, and we need to be putting them on the ventilator. And it's rather dramatic. And so it's different. And, part of the reasons why you may be hearing different advice coming out is because the Delta variant is a different animal. People are getting sicker, and it's much more contagious.
And so in the hospital here, we have, I think, 3 or 4 patients who are vaccinated and have COVID. And that's out of a set of a number of about 50 patients. So you can get COVID after you're vaccinated, but what we're told is that even at that, the effects of COVID are much less if you've been vaccinated. You want to address that?
Yeah, that's exactly what we're seeing. We all know people, I assume we all know people who've had the vaccine who've been diagnosed with COVID and had very mild symptoms at home, and it just sort of ran its course and didn't cause any major problems. We've had a few in the hospital that have come in. Quite frankly, a couple of those were in for reasons other than COVID. They got diagnosed as COVID and they incidentally tested positive, but they were here for other reasons. And then there's a couple, and those people don't seem to get as sick as the others. So even if they are one of these breakthrough cases, they seem to be gaining protection from the vaccine that they had. And I don't think there's any doubt. I don't think the numbers lie. I don't think the experience lies that, if you're vaccinated, you're protected. I mean, it's just what we're seeing across the board from other hospitals. And David, you have any comments on it?
No, I'm clearly seeing the same thing. If you're vaccinated, can you still catch COVID? Yeah. I've seen many people still catch it, but they're not getting as sick and they're not coming to the hospital for the most part. And kind of to speak more on a personal level about getting vaccines, I could talk to you about all the science behind it and the statistics and everything else. But really, kind of really break it down to, and I don't know if I get in trouble for saying this, but I really hate COVID. I dislike it. I hate seeing people die. And when you are with a person and you can see them go through these emotions, whether it's fear and anxiety and desire to meet with their families, but they can't, and then you see them get sick and eventually die, it really affects you. I hate how it disrupts my life and my family's life. But, vaccines, they work, and people aren't going to get as sick. And, we can change our minds. Maybe at first people didn't know, but we can just get it now and be safe. I say that because I care about the community. I care about the people here. I am super vigilant in making sure I don't get sick because I want to be able to work and help and take care of patients, even though I'm working all day long. And it's very stressful on me. So, we're a community, we're a strong community. We care about one another, we love one another, and we band together. And I think this is a time, more than any time, that we band together and we take care of one another. And we get vaccinated and we stay safe and we try and protect each other.
Great comments from the heart too. And Paul, thanks for your comments about the effects of the vaccine. And let me say this, I think a lot of people know this, but I had COVID. I was diagnosed on Christmas Day, and I ended up in a 3-day stay in the hospital because I couldn't breathe correctly. And it took me a couple of months after that to try to get back to a status where I could work out. And then I was also vaccinated. And I think that it's wise to do that. So in summary today, we wanted to briefly come to you all with that message. And as Dr. Patten said, maybe some of us need to rethink our position on it. Maybe we just weren't diligent enough or careful enough in some cases, and avoid a lot of really not so good things, death included, as well as disruption to our business, to our lives, to our social, to our families, to about every aspect of our lives by being vaccinated. Thank you for your time.
Thank you.
Thank you.